the big news here today, obviously testing is critical. Everybody in the medical community seems to agree on at least one thing, which is that testing is critical in order to get things open and going again. And so your big news here is that you're going to be able to test anybody?
Yeah, no, we've actually been running testing, extensive testing. We've done thousands of tests since the beginning of April, and have found quite a few positives, and have been right in the middle of all of this testing. We've been also doing some testing with the actual antibodies. So there's two components here. There's testing for the active infection, which is a nasal swab, and then there's the testing for the antibody, or the markers of immunity. That's a blood test. We've been running some tests internally with our lab partner, our national lab partner, and the exciting thing is that not only are we able to perform the tests for the active infection, but now after doing several tests on small groups and testing these, including even a couple of local physicians, we're now able to launch this to the public. In fact, we just launched it in the last couple of hours.
And launching this meaning whether or not you have symptoms, you can get a test and you can get that antibody test.
Yeah, that's exactly right. So there's a couple of components, right? Like you just said, there's testing for the active infection, and I'm sorry if I didn't say this clearly before, my fault. The active infection has been available, and we are the only one that we're aware of locally right now that's able to do this on asymptomatic patients, meaning
right. And just to be clear, the difference between the antibody testing and the diagnostic test, I'm clear on that. Just what I'm kind of surprised by, frankly, is the idea that anybody can get one, because I think that's what we keep hearing about, is this lack of testing availabilities. People who are symptomatic going to hospitals and not being able to get a test. How is it that you're able to then test people so readily?
Yeah, great question. So we actually have adequate supplies, certainly for the antibody testing, and we're going to do everything we can to stay ahead of the curve. Our number of supplies have been increasing. We've utilized several sources of testing, and we're working very closely with Quest Diagnostics, who has national resources. There have been absolute limitations. There is no doubt. You're 100% correct. But we've just made the decision, especially since we've had access to more testing recently, that we're going to do everything we can to take care of the community, and to make sure that we have as many tests as possible, available for everyone.
And so, how much does a test like this cost? Either the diagnostic or antibody?
Yeah, great question. So the vast majority of these are all being submitted through people's insurance, and we're billing all of those and handling all of that through insurance. We just want to take care of the patients. For the uninsured, we just were able to drop our pricing. Unfortunately, the testing is still quite expensive, but we were able to drop our pricing by another $100. And the total price for the swab test is $249, and for the antibody test is $299. That's including a medical evaluation, because many of these patients are ill and sick, and we just need to make sure that nothing else is going on. And we're looking to further reduce those pricing. But for the vast majority of patients, that we'll be seeing, we'll obviously do everything we can to bill their insurance and to save their out-of-pocket expenses.
What kind of antibody test are you using?
That's an excellent question. So you're probably aware there's two different antibodies that are commonly evaluated when we're assessing somebody's immunity or antibody response to an infection. There's the IgM and the IgG, and some test for both. The IgM comes in early in the infection process and doesn't last very long, but is a very early marker. The IgG test, which is the one that we do and the one that we're doing through Quest Diagnostics, is the one that lasts much longer, takes a little longer to show up, 10 days. Some people say as many as 18 days after infection. But when it arrives, that is the antibody that conveys the immunity that everybody's looking for, whether it's from an active infection or from an immunization.
And there are a lot of, obviously, developers, manufacturers who are working on tests like these. It's kind of the quest for the holy grail right now, is to come up with not only the vaccine, but again, more of these tests, more faster tests, more accessible tests. Can you say like the brand, the company that's making the tests that you guys are using?
Yeah, this test is being made by Abbott. You may recognize Abbott's name as well because they're one of the three manufacturers that are approved for waived testing and extensive testing in the United States for the actual infection itself, the RNA test or the swab test. But they also are one of the only 12 that the FDA has approved, or 12 manufacturers that the FDA has approved for antibody testing. So yeah, this is from Abbott.
Wow, I mean that's a huge get for St. Louis. Talk about just, the reason you want to get this in, not only these tests themselves, but the information out there to people right now.
Well, we want to make sure that people, a lot of people think that they may have been infected or aren't sure if they're infected. A lot of employers want to get back to work. It will provide great peace of mind if we can. It will let people know that they're actually making the antibodies that everyone hopes an immunization will provide for us in the next year or two, as soon as an immunization can be developed. But actually having the antibodies conferring immunity in the bloodstream would really allow people to have a lot more confidence being back at work and having the confidence that they're not actively producing the virus in an asymptomatic state or around elderly or loved ones. As part of our testing, I'll tell you, I tested my blood along with a couple of other employees, and mine was unfortunately negative. And I've got older loved ones that I want to go visit. I haven't seen my parents in a while, and I was actually hoping mine would be positive, but a few other people have had positives, and it'll give us better insight into the disease burden and the prevalence as well. So there's several pieces of very helpful information that'll be conveyed, and we're very excited to bring this to the people of St. Louis to help St. Louis safely get back to work.
It's a blood test?
Correct. The antibody test is a blood test. That's correct.
And then the diagnostic test is that famous long Q-tip that scratches your brain a little bit, right?
That's right. It goes all the way back to your posterior nasopharynx, so that kind of the top of your throat behind your nose, and it definitely feels like it's going all the way back to your brain. Now, the good news is that the Abbott testing that does the molecular PCR testing that we're hoping to get, in fact, I literally just got off the phone with within the last 15 minutes, that one only uses the front of your nose, so it's a much more comfortable swab than the one that goes all the way back. And we hope to have that one on site for immediate results. And we've been assured that we'll be the first in the region to have that when it becomes available. And then people will know whether they're infected within 15 minutes as soon as that one rolls out. But I don't have that great news for you today. I have asymptomatic testing available for everyone, both antibody and infection. And we've been getting those results back in 1 to 3 days. And we're looking to push that envelope and make that even faster.
You just mentioned a lot of the great things that would come with knowing knowing someone has the antibodies, but there have also been a lot of words of caution against the idea that this is an all clear or that this is a passport to get back to normal, if you will. So I guess just, your perspective on just the concern that antibodies are not necessarily the end all be all to being able to resume life as you knew it before this, I guess.
Yeah, no, in life, a lot of times we want absolute. In medicine, there's no absolute. There's no guarantees. Obviously, the nature of medicine is that we never know the way things are going to proceed, and we always have to wait for more data and more scientific validation. So, everyone who's waiting for an immunization as the end all, as the great protector, please understand the way that works is that it helps you produce antibodies. So there's no better antibody to an infection than actually having responded, or no better immunological protection than actually having responded. That having been said, you're 100% correct. We don't know the mutation rate of this virus. We don't know exactly what long-term immunity means. We don't know how long these antibodies are going to last. That's true for the vast majority of viral infections, but it is true that we do not have adequate data to comment on with certainty on the long-term effects and meaning of the results of these tests. But before we're too gloomy on that's true with all scientific information, and it's very reasonable to believe that our body's protection from viruses that's been protecting us for hundreds of thousands of years, the same principles are going to apply now.
Speaking of data, what do you do with the data that you come up with? I mean, being a series of, or not a series, a group of urgent care facilities, what is your reporting protocol for when you get positive tests or when you get positive antibody tests at this point? Like, how do you kind of convey that to the decision makers now?
Oh, that's a great question. So when you're talking about obviously the individual decision maker, we call the patient back and we make sure that they're aware. In fact, right now, we reach out, of course, to everyone that has a negative swab for the active infection. Everyone who has a positive swab, and again, we've had hundreds of those. They get a call from one of our providers. They get a call from an actually experienced, trained physician or one of our other healthcare providers to talk them through their symptoms and the progression of their illness. Everyone for antibody testing, whether they're positive or negative, will also get a call from one of our providers. Now, in terms of the decision makers beyond the individual decisions, all of these results are reportable. All positives are reportable, and the state hasn't been clear with us yet, but we believe all antibody tests are reportable. So we obviously let all public health experts and all of our public health colleagues know the answer to these questions so that they can make local decisions, allocate resources, and contact trace.
Yeah, because I mean, that seems like it would be a major deal for, there's a total access on every corner sometimes it feels like in the St. Louis area. And for you to say we have enough testing, that could really change the game and change what the situation looks like, as far as reopening our different municipalities around here.
Yeah, we absolutely hope. You were right early when you asked me, how do I know? I am not certain that I am not certain that it's not possible that we're going to run out of testing, but we're going to do everything we can to stay ahead of the curve. Several weeks ago, 5 weeks ago, we were worried about running out of masks for our staff or gloves, and we've really feel like we've gotten ahead of that curve by at least several months. And so we're going to do everything we can to stay ahead of testing. Is it possible that we won't have enough? If the people of St. Louis respond to this overwhelmingly and Quest can't keep up, that is a possibility. But that's the truth with everything in COVID. I mean, quite a few supplies have been compromised, and not just in the medical supply chain. But we have a commitment to the people of St. Louis, and there's no point in us sitting on tests that we have right now when helpful information can be provided, and we're going to do everything we can to backfill and make sure that we have the resources to continue to, like you say, provide the people of St. Louis the reassurance they need, and allow the city to reopen.
I thought that we weren't supposed to be making people or letting people who are asymptomatic go get tests. Why would you advise someone who is asymptomatic to get tested anyway?
You're absolutely right. Early on in the illness, the guidance was that people were not supposed to be tested when they were asymptomatic. And it is true that if you are asymptomatic, it is possible that you're too early in the infection, that you're not shedding virus yet. But the reality is that various other international experiences, whether it be South Korea or China or Italy or Germany, a cornerstone of their relative success has been testing certain parts of the population that are concerned. We're not randomly testing members of the public on the street. These are people that are concerned that they've been exposed. And or in the case of antibody testing, it's slightly different. But people that are concerned that they've been exposed and are coming in. So these guidelines have evolved dramatically, but there has been quite a bit of asymptomatic testing in various places in the United States and certainly in the world as part of the response to this. So the goal was, if we have extremely limited testing supplies, that we only use those on the highest risk cases. But even the drive-throughs or the hospitals, everywhere in the nation has changed their guidelines as our relative disease burden and supply lines have changed. So you are correct that testing someone who's asymptomatic, it is possible that you'll get a negative result when they're too early to have started to shed virus. But we know that they're not actively shedding virus at the time of the test, and it's being used by public health planners and employers to get a sense of their active disease burden as various industries open.
Hmm. Very, very interesting. Are you guys prepared for the potential rush on your clinics with this news?
Oh, well, you may or may not be aware of this, but healthcare has been affected like everyone else, and my heart goes out to all the small business owners and these the depression-like unemployment numbers that we've had across the nation. But our numbers are dramatically down. You know, in February we had the honor of taking care of about 1,500 patients every day. And now we have maybe a third of that, or a little bit more. We're taking care of only 500 or 600. So our team is built for dramatically more patients than we're taking care of, and I am absolutely confident that we'll be able to continue to fulfill our mission and serve the people of our great city.
Well, I hope this news winds up being as good as it sounds, because it sounds like a huge, major thing, and I really appreciate you guys sharing it with us. Is there anything else that you feel like you wanted to make sure you mentioned here?
No, I really appreciate the time. We're honored to be part of part of the fabric and a crucial contributor to the communities of St. Louis. And I certainly encourage everyone to continue to maintain a reasonable, safe habits. I hope everyone can get back to a happy interaction, but we need to maintain our appropriate distance and obviously be careful about symptoms, wear masks where appropriate in public spaces, and wash our hands regularly, avoid touching our faces, all the standard advice, so that we can continue to keep this virus's transmission to a minimum and protect the most vulnerable members of civilization, those with comorbidities and the elderly.
I so appreciate your time. Thank you so, so much.